are really excited about bringing to you today two community coalitions, if you will. Some of you have heard from our partners, the LA County Perinatal Mental Health Task Force, in the past. In fact, they presented at our forum last year, and they're back to share more of their good work. The task force is an established nonprofit organization under a fiscal sponsor and has been doing great work for quite some time. And we're also going to be hearing from Butte County, both a public health director and also a First Five employee in Butte County. And I'm so excited for you to get to hear their work as well, particularly because so much of it is very raw and they're experiencing some of the difficulties that we think often will come with the territory in doing this community coalition work. So without further ado, I'm going to go ahead and introduce Anna Bauer and Ann Dickman from Butte County. And ladies, please feel free to introduce yourselves and give us a little background about yourselves as well.
Great. Thank you very much. Thank you so much, Joy, for inviting us to this event. This is a lovely gathering that you have, and I mean, what amazing presenters. We're so excited to share the work that we've been doing for the past few years, but really it's picked up in earnest within the last year in Butte County. So we hope this is informative. We're going to keep it fairly casual. Feel free to ask us questions. My name is Anna Bauer. I'm a mother of a 5-year-old and a 7-year-old, and I'm also a part-time staff person with Butte County First Five Children and Families Commission, and I've been in this capacity for 5 or 6 years now.
And I am the mother of 3 adult children, and in the last 20 months have become the grandmother of 3 adorable grandbabies. You're just lucky that their pictures aren't plastered up there, because that's how I feel about them. And I have been the MCH director, maternal child adolescent health director for Butte County since 2007. And a lot of people kind of want to know, well, where's Butte County? And I'll hear people say, oh, you live in Chico. Isn't there a prison there? And I'll say, no, that's Chino. We have a college, though. You've probably heard of our college. So Butte County, the bottommost tip or southernmost tip is about 60 miles from Sacramento. We have a population of 222,000 or whatever, that big number that you see up there. And then our ethnicity, as you can see, we're not as diverse as many, many parts of California, still with 74% of our population being Caucasian. I will say also that our birth ethnicities really follow these. They're very close to our overall general ethnicity. In 2013, we had 2,415 births. So my daughter gave birth at a hospital in Atlanta, and they do 2,500 births a month. So just put me in perspective right there. And 26.3% of our children under age 18 live in poverty. And one of the things that we know about Butte County is it tends to be very conservative in terms of a voter base. And so those ideas of really funding your future by looking at tax revenue and those types of things, definitely a harder sell in our communities. We also have a very conservative medical community that is fabulous, but the idea of taking on new things and changing the way we do business is a hard sell, and I know you can all relate to that. Currently, our physicians are really reeling from the adoption of Medi-Cal managed care, again, something new to us. Many of you have experienced that for years, and right now, most of our OB docs are seeking refuge into hospital umbrellas instead of having their private businesses. Major upheaval in our obstetrical world and our pediatric world. So we'll see where that leaves us. Yeah.
So First Five Butte County identified as part of their health initiative that maternal mental health was a priority. And this was a number of years ago after engaging multiple groups and stakeholders. And so essentially we mapped out some steps that we thought would be the ideal first steps to take in that effort. And one of the key first steps I think that we took was we identified 7 local professionals, and they came from a variety of backgrounds. There was a pediatrician, an obstetrics department director, a social worker from a major hospital, Anne, our behavioral health director, an OB mid-level provider. So Holly is a physician's assistant, certified midwife, and a First Five staff person. And that 7 core group, which we came to call the Seattle 7, We sent them up to the PSI conference in Seattle with the agreement that the group would convene regularly and begin to really work in earnest on this issue of maternal mental health in the county. And that turned out to be a really great move. From that, some excellent relationships were formed. We ended up identifying a need for additional mental health services within our Healthy Families America home visitation program. What really the paraprofessionals were saying was that these mommies had much more significant mental health issues than they could deal with. And as a result of that relationship from the Seattle trip, behavioral health came on as a partner, and we were able to double the first 5 funding by drawing down some FFP funds. And so essentially we could serve twice as many moms within that program. So that was a great, albeit small success, but it was a great success for being able to serve this particular subset of moms. That service at that time was only available to women who were enrolled in a first 5 funded program. So lots and lots of women in the community. Additionally, go to the next slide. First 5 sponsored multiple trainings, and these were fantastic trainings. Peck Inman came and did some amazing work. She did a full day, which involved working with social workers and case managers. Also did some breakout sessions with the CMEs for the physicians and the nurses. We brought Peck and Dr. Carolyn Krabari back to do a 2-day PSI certification, which was well attended. We had about 40 folks attend. And then we brought Dr. Carolyn Krabari back in 2013 to do education specific with the physicians for how to medically manage maternal health. There's a little bit of a takeaway from this, though. We didn't have any other systems in place, and so the training kind of went into the pipeline, and folks were really satisfied with it. They loved the trainings. They were very high quality trainings, but nothing changed in our community as a result of those efforts. And, for some reason, we didn't anticipate that. We thought that, all we need to do is train and certify 40 folks. They'll go forward and conquer, and we'll kind of move on to the next issue. And that is not what happened. So things languished a little bit. We had some staffing changes, both at the behavioral health department within first 5. Some people who had been part of the first group of 7 moved on. And just not very much was really happening. And a woman named Deanne Blankenship from the California Health Collaborative contacted us a little bit out of the blue about a year ago, and they have a pretty excellent program in Fresno County that is funded through First 5 that provides this comprehensive case management for maternal wellness. And Deanne and her crew really wanted to see if they could bring something like that to Butte County. They do have an office in Butte County. I said, well, as long as I don't have to run it or, do too much, if I can just show up, then sure, I guess we can talk. And so she's been amazing. She's really brought a lot of life back to our group. And this time around, we really had some organization to the process, and I think took some of the learning from the initial stages and were able to say, all right, so we know we already did the education. Because one of the first things Deanne brought to the table was, well, so we need to educate the doctors, and we need to train the therapists, and I said, we've already done all those things. So we were able to kind of bypass that step and identify a group, a pretty devoted group, that was going to work on 4, can you not hear me? Oh, wow, that's close. That was going to work on 4 different areas of emphasis. So we've got folks working on outreach and collaboration with Medi-Cal Managed Care. When I say folks, really that's Deanne. She's got the connection with the health insurance companies. I have, the rest of us know very little about health insurance, but what a huge piece, because really without the health insurance being on board, we're not ever going to get to that sustainable piece, which is what we need. There's not a lot of funding in Butte County. We don't draw down foundation funding. First 5 isn't really in a position, I don't know if this is happening in your counties, but we're not really in a position anymore to fund on a large scale. We've spent a majority of the fund balance, and now, we're really having to prioritize our funding. Working on resource mapping. So what we realized was the only actual resources that we could identify in our community that were reasonable to post to the general public were all national resources. We couldn't post the Mother's Well program because that's only available to certain moms who are involved in certain programs. And we couldn't post this, there's another program up in Paradise, but the pathways to get into these programs were so convoluted that we couldn't really list them as resources. So still our resources are, the variety of 1-800 numbers, and there's some great websites out there. So we're working on how do we create resources that then are accessible that we can post and call them resources. Education and outreach. man, that has taken a life of its own, and we're going to talk a little bit more about some plans we have with that. But, we're ready to launch an awareness campaign to, partner right up with the May campaign. We've got this amazing group at the university that is a group of marketing and PR students who are working with us. They've helped brand us and helped give us some kind of direction so that we're appealing to the general public and to our target population, and they've kept us from making brochures and doing, silly things like that we shouldn't do anymore, apparently. They've even convinced us to have Facebook, and we're actually getting there. And the fourth group is the support group work group, and this has been fascinating. Support groups have been part of the conversation the whole time, and yet a support group has been started and is up and running, and there's been all this hesitation to call out postpartum depression in the title or the descriptive language of the support group. And we've spent all this time working within our larger work group about, well, why don't you want to call it for postpartum depression? Maybe the moms won't come if they think it's for perky moms. And it's been fascinating. We're kind of coming full circle with that. But is there still such a stigma that we think if we label it that folks won't come? Apparently. I mean, that's what our advisors are telling us on this group. But we do feel like support groups are a key piece, and yet one of the more difficult to sustain and support from our perspective. So the members of our Mother Strong group, as you can see, it's a fairly diverse crew. We've got folks from 2 out of the 3 hospitals. We've got a licensed clinical social worker from our major children's health center. We've got our maternal child adolescent health director, First 5, of course, the health collaborative. Who I didn't put on here was we've got 211 as a partner, and they've been an amazing partner and are part of our single point of entry for that resource and referral, and they're hosting our website, and they really want to be known as one of the ways to access this information. We've got a few of our community-based organizations, Northern Valley Catholic Social Services. They host the Mother's Well Therapy Program, and they also host our home visitation programs. So they're really in the households and in the lives of some of the women that will be accessing these services. We have the private practice therapists, which is exciting because we feel like there's a place for therapists to have a business model around this that doesn't necessarily require First 5 funding or additional funding, that this could sort of be sustainable in and of itself. We've got a behavioral health clinician from Butte County. Butte County is very overwhelmed with being able to serve the severe population, and we're very challenged within our county mental health system at this point to serve the mild to moderate. So that's definitely been a barrier, and we're very glad to have behavioral health on board working on that with us. Child Abuse Prevention Council, of course. Youth for Change, which is another community-based organization, and I didn't, because we hadn't really secured her by the time we made this PowerPoint. We have a champion. We have a mother, like an actual specimen, who comes to the meetings with her baby and is a survivor and talks about her experience, and she's so enthusiastic and so heartfelt about what she went through and her challenges for not having resources. And this was what we were hoping would happen eventually, was that the women in the community would start to resonate with them, because we really feel like that's the sustainability of this effort, and that's the effort that we can probably most effectively support in the long term. So the California Health Collaborative, bless Deanne, keeps us on track. We get very, we want to talk about centerpieces, and we get very kind of squirrelish, and she's been great in just really keeping us focused, and I feel like that's been a key element this time around, to find someone who wanted to manage us in that way.
So we also wanted to, while we were listing the collaboration members that we have, we wanted to list those folks that have really helped us create this vision. And what has been exciting about this last 6 months has been this revitalization that we've experienced. And it's almost as if doors have been opening for us. We just had kind of a very unfruitful time period, and now it just seems like we're getting phone calls, we're finding moms, and so we want to call out Shasta County MCH department. They created a program to address postpartum depression many years ago, and it's still going. So kudos to them for keeping that up and running. Also, Tulare County has done a phenomenal job with their postpartum depression program. And both of those programs really helped us craft an intervention program we think will work. Oh, did it go out? and back in, okay, in Butte County, which I'll share later. We also got to speak with Catherine O'Brien, and she is a private therapist, but again, just through the course of her experience as a therapist, started picking up women with postpartum depression and became a PSI chapter all on her own. So being as close to her as we are geographically is great news. And then we got to meet with Joy and Anna Sutton. So Joy is, well, you've all met Joy. And then Anna Sutton is the perinatal services coordinator for Yolo County. We got to do a phone conversation with them, which was very encouraging and really, again, just these strides forward. And then again, our champion moms, and know that we're going to learn so much more from them. So we've really created like a three-pronged approach to this. The first one, of course, is awareness, the resource mapping. And we're just so thrilled that these beautiful materials are already available. We do have this marketing group through Chico State that is helping us with our program. And so we will continue to rely on them, but they will take some of these materials and help brand them with our brand, which is allowed. There's a place that says you can put your stuff there. We're not going to take over. And our goal is that every stakeholder in the community will know about postpartum depression. It will not be something that's silent. So moms will know. Moms of moms will know. Husbands will know. Doctors will know. And again, that's kind of one of our strongholds. So we're really looking for the moms to then come up behind us and ask for treatment and ask for help. You know, we want our policymakers to know as well. We want to see some changes in the way we do business. And there are some promising practices that are happening right now within our FQHCs and others, so we're very much looking forward to seeing these become just the way we do business. So this is really our pathway to care, and it's really based on what we learned from Shasta, Tulare, and from others. And so obviously we need a trained referral network. We know there's low-hanging fruit with that. We know that we've got our WIC workers potentially. We have maybe office staff. We have our home visitors. We have folks that are kind of in our corner right now easily, and they will make that front line of referring. So we will train in the Edinburgh. We will train in the assist so that they aren't afraid to ask if somebody has ever contemplated suicide. And we will give them the skills to be that referring network that we need. And again, obviously our vision is that everywhere a pregnant and postpartum mom goes, she will be screened. Pediatrics everywhere. We also know from our providers' statements and just the way we do business, we have to have that single point of entry. If the doctor has to look at, or the midwife, what insurance, therefore this pathway, we know we'll fall apart before we start. And so what we would like to do is create a single point of entry. Right now, in terms of sustainability, we feel like the Public Health Department is a great place because we could draw down federal financial participation. We're pretty convinced the majority of the women we will serve, certainly at first, will be Medi-Cal because that's where the referring networks will be much more established for a while. From there, we see that person being really the expert in everything. The collaborative is working on the Anthem Blue Cross managed Medi-Cal. So if the woman has that, they would be referred warm handoff to that system. California Health and Wellness has their own system. We will make sure they get the warm handoff to California Health and Wellness. And then as other maybe organic programs are created through our FQHCs and rural health centers, potentially referred through those. But again, this will be our resource and referral expert in all things perinatal depression. We envision this person doing telephonic case management throughout the course of treatment for our women to help connect them, make sure they're not dropping out of sight, that if the heat bill becomes a problem, we can help them with the heat bill because it's hard to do everything when life's falling apart at home. So working on those things. And then three prongs that we see with that is obviously counseling, huge in terms of treatment for women. Well, we want to see the Mother's Well program expand. We've already got a relationship with behavioral health. We're already drawing down FFP. So that helps in that sustainable model. We could keep that going for a much longer period of time, and hopefully something we will just continue. But we also see great wealth in our private therapists. We feel like there's plenty of women out there who do have insurance and can pay for that service. So we'd love to have a trained cadre of private therapists out there to support women who have who have more access to services and funding. We do envision an MOU with behavioral health. There are some women who have persistent mental health issues that go beyond postpartum depression, and we need to be able to fast track them. We need to be able to help them into that system for long-term wellness. Another piece of this is classes, an interesting concept. We have many nurses at our hospitals that would love to be involved, but they're scared to death to do a support group because they're not therapists. And if you're a nurse out there, you know we protect our license like it's gold, which it is. And so when we approached them and said, well, would you teach a class about postpartum depression? Maybe put some crafting in there and do some activities that help draw women together. And they went, oh yeah, no problem, I teach. And so by doing the class concept, we have women who maybe won't seek therapy, but would do a class or maybe do both. That's fine with us. And also in the CPSP world, we can draw down funding for that in many occasions. And then the last piece is the support groups. And of course, those are very vital to what we're doing. It's been a very funny path for us, again, because nobody wanted to be branded for postpartum depression. Although interestingly enough, at our meeting yesterday, they read their new write-up that will be in the Nest and on the Nest website. Isn't that the great name for a place for pregnant and postpartum mommies to hang out, at the Nest? And it was a title or a description they created, and it's about revolution. And they are going to revolutionize this area. And so it kind of fits with our Mother Strong idea. So it looks like we will have postpartum depression now in the title of our support groups, it's real important to us to have that advertised. And then underneath that is obviously the need for ongoing education and awareness. We need to help our therapists learn how to bill insurances so that they can get paid. We need to create a strong infrastructure or scaffolding so that we can continue this work beyond First Five funding, because it's not going to be here forever. And so our goal is to create a program that can withstand some struggles in the future. Closing up here. I know we're getting there. And then finally, this is something we are so excited about. Again, we feel like the women are the voice for this program. The Mothering Summit is going to be held May 9th. Our lovely Enloe Medical Center has offered their beautiful conference center for us. It's going to be a 4-hour event just for moms. And our goal there is to be able to have them tell their stories, learn more about perinatal mood and anxiety disorder. It looks like can I say who we're going to have? Yeah. Okay. Shoshana Bennett's going to come up and be our keynote speaker there. We're going to do some breakouts. We want to do some walls up where moms can tell us their stories, or possibly some photos, about, those signs that people put up. Oh, okay. And so we're very excited about this. And as we adopted this champion mom, oh yeah, that's right. Thank you. And Bendu is coming. Yes. 2020 Mom is actually going to close the event, because what we want, again, is this swell, this organic movement among moms. And really what I've seen through the 2020 Mom Project is that activation and that, that synthesis of everybody's skills and gifts to create awareness and keep this project going. So essentially, I guess our final piece de resistance would be that we have mom-led support groups, and that we see those women that have those stories to tell, that have survived this, this period in their life, bring that life and hope to other women. and hopefully in the course of that, continue the movement. And again, First Five has a great role in that because we want to build capacity among those moms. And so give them the training it takes to facilitate and lead, and then provide mentoring. So it's something we're very excited about. And anyway, and when we met our champion mom, she said, yes, this is great. So that was good. So again, our job right now is just this paradigm shift, and we want to minimize the impact and frequency of perinatal mood and anxiety disorder, shift from minimizing it to validating and providing services to all affected women. So we join with you in your efforts and would love to learn from all of you as well. So thank you.
Thank you. Well, bravo for all the work that you're doing. It's hard work, and we are excited to learn from you and your experiments, and really excited about partnering with you. So we're going to hear now from the Los Angeles County Perinatal Mental Health Task Force, and I'm going to let these three gals who have also become dear friends say hello and introduce themselves and kick us off. And we'll have perhaps a couple minutes at the very end for question and answer. If we don't, we'll take questions for these guys at the end of the next panel as well.
Right up to my mouth. Okay, you can hear me? My name is Gabrielle Kaufman. I'm the director of the Training Institute for the LA County Perinatal Mental Health Task Force.
My name's Karen Post. I'm the executive director of our organization and a clinical psychologist.
And I am Jo Bloomfield, the policy director.
So thank you for your presentation. It's really exciting to hear about what you guys are doing. And Dr. Filiti, that was amazing. Wonderful to hear you. So what we're trying to do is kind of take all of these global ideas and bring them locally to LA. And we've been around since 2007 and have accomplished some pretty exciting things with a lot of volunteer power. Oh, I use this? I just forward. Okay. Can you forward again? Okay, can you forward? Oh, we're over there. Oh, shoot. Can I go back? That's good. So our mission is to reduce the barriers to the prevention, the screening, the detection, and treatment for perinatal mood disorders in Los Angeles County. And we want to raise awareness to improve all of those things and help each woman experience a happy and healthy pregnancy and postpartum period. And help each woman and primary caregiver and family bond with a loving, attentive parent. Help each infant do that. And help each family enjoy a smoother transition to parenthood. And mostly now our efforts are, after having success in these different realms, are to really align a system of care right here in our backyard in Los Angeles. So, take it away, Jo.
Hello. I'm just going to present a little data, and one of our wonderful partners is the Department of Public Health Maternal, Child, and Adolescent Programs, and they conduct this Los Angeles Mommy and Baby Study, and as you can see, the rates of this is all self-reported, the rates of self-reported depressive symptoms during pregnancy and after birth are really striking in this county. It might be too small for you to see, so I'll just tell you that self-reported depression before pregnancy is at 11%, during 29.7%, and after is 47.3%. And there are about 130,000 births in LA County. So when you think about what those numbers mean, it's enormous. And this goes along with what Marguerite was saying before. If you remember that number, 29.7% reported depressive symptoms during pregnancy, this is the breakup among different racial and ethnic groups. And if you see African American, it's 39.5%. And we know that during pregnancy, depression causes low birth weight, preterm birth, And as you can see, in the Hispanic community, which is enormous in LA, it's also incredibly high. Go ahead. And then during the postpartum period, what's interesting is that the numbers level out a little bit in LA. So just in general, those self-reported depressive symptoms are pretty stable, but the severe depressive symptoms or moderate depressive symptoms are much higher when women have significant risk factors. So with incomes less than $20,000 a year, they're 3 times as likely to report severe depressed mood. And that's compared with women with incomes over $60,000. When we look at women over $100,000, that disparity is greatly increased. Less than a high school education, or more than 2.5 times, is likely to have severe depressed mood, and no partner 2 times. And then lastly, these numbers are from 2012, and they are looking at who's asked by their provider whether they're experiencing depression or anxiety during pregnancy or at the postpartum visit. And these numbers have improved a lot, actually, which is a testament to hopefully the work that's going on in this area. But what we're really still trying to change is especially those postpartum numbers and the anxiety number, because as we know, so many women are not depressed during the postpartum period. They're anxious, but they don't know that that's a problem. So I'm going to turn it back to Karen.
Okay, great. I'm just going to briefly tell you how and why we formed, and tell you a little bit about our founder's story. So Kimberly Wong, in 2003, she was a public defender in LA with lots of resources, experienced a severe and life-threatening postpartum depression in which she tried twice to kill herself. She found, despite these resources that she had, that she could not find help in her own backyard. When she recovered, she decided to form the task force in 2007, and all volunteer, and just started cold calling around LA, Department of Public Health, Maternal Child Adolescent Health, LABBN. Would you like to be involved? Would you like to be involved? And everybody said, yes, we really would like to be. This has been our one of our top 10 issues, but we don't have an organization to deal with it. And the reason why it says from empanadas to infinity and beyond is that's how she got people to come to the meetings. She would just bring empanadas. So people were self-motivated, but the empanadas helped. And we've been able to accomplish quite a bit since that time. Started all volunteer, and now we have a lot of foundational support from some of the larger foundations in Los Angeles, from First 5 LA, and private foundations as well, and our donors. And we also still have a very large volunteer network. So I think that's all I want to say about that right now. Some of our programs and partners are really important to mention because you're all here in this room, and you are all why we've been able to make a difference to the extent we have in LA from all of us working together. And that's LA Best Babies Network, the Magnolia Place Initiative, LA County Department of Public Health, PSI, 2020 Mom Project, Jewish Family Services, Nurse Family Partnership, Pathways LA, so all sectors, early childhood, mental health, physical health, child welfare, El Nido Family Services, Para los Niños, Great Beginnings for Black Babies, Junior League, USC Eisner Family Medicine, Harbor Community Clinic, LAC USC, UCLA Westwood and Harbor hospitals. So those clinics and hospitals are where we have pilot and demonstration projects where we are integrating perinatal mental health into primary care or pediatric or obstetrical practices. The Department of Children and Family Services, DMH, DHS, Esperanza House, where the promotoras work, MCH, Access Welcome Baby. I know you have a very strong presence here today. PACLAC, St. John's Well Child Clinic Center, Children's Bureau, the Westside Infant and Family Network, which is doing a lot of research with the ACEs right now, and executive functioning and maternal mental health. and the Westside Children's Center. Those are just some of our partners. Again, people are partnering and coming to the table because they care so much about this issue. Our work is basically a three-legged stool: public awareness and stigma reduction, our training institute, and our policy, advocacy, and legislation arm or leg. So some of our campaigns, so we have many public awareness events and programs. We have a brochure, 6 things every new mom and mom-to-be should know about maternal depression, in 7 of the LA threshold languages, and we have as many of those as you would like for free. Please come and let us know if you want them. We have a whole campaign of Speak Up When You're Down, and this May we're working very intensively with the Magnolia Place Community Initiative to really go deeper and spread the awareness more widely in that community. And we have an amazing Share Your Story Speaker Bureau program, which Joe is going to talk about in a little while. And Done in a Day we've done with Junior League, where Junior League goes out in their cars or mails things and works with PACLAC and the other hospitals and gets our brochures into new moms' birthing packets, and many more things. I think we can skip over that. And then who goes next? Yeah, my dear.
That's me. Okay. So I'm going to just quickly talk about the Training Institute. How many of you have been to a training of the Training Institute? I'm so sorry. The Training Institute is really a wonderful group of clinicians and educators who have come together to help develop a curriculum. And the curriculum is aimed at providing skills, resources, information, statistics, and it's tailored towards each population and demographic that we're serving to be able to screen and treat women in the community with perinatal mental health disorders. So the goal is to understand maternal mental health, learn to recognize and respond, to communicate in culturally sensitive form, and recognizing the diversity in this county. You know, one of the interesting things is we have 7 threshold languages, and regularly people say, what? You don't have Khmer? You don't have Russian? You know, there are so many languages that we don't have that Los Angeles represents. In fact, as you were speaking, I thought it was really, it's so opposite. Your the number of births in your county and the number of births in Los Angeles. Los Angeles has 150,000 births a year, which is like one of the larger states in the United States. At any rate, so our numbers are really high, and the diversity is really high, and the complexity of the issue and the geography is really complex, which is why we had to have this training institute to be able to expand. And in some ways, I envy the ability to kind of condense and bring people together, and it has created a lot more complex landscape. The flip side of that is we get to work with so many partners, so it's been wonderful for that reason. Okay, so let me just quickly go behind our philosophy. It is trauma-informed, biopsychosocial, empathy-based. We work on attachment theory and practice. We look at multi-generational transmission, both of trauma, but of resilience as well. We look at protective factors, cultural competence, and we are looking at some of the evidence-based practices for treatment, including IPT and CBT, and some of the other interventions, including dyadic treatments. Okay, what's next? I got it. Okay, so protective factors. I already talked about this. One of the things that we also find, as you already know, is working on social connections, and that's actually where support groups come in. Support groups, as probably all of you know, are really very complex, very difficult to start, very difficult to continue and generate. But social connections can help both build those support groups, build the safety for coming and talking in those places, and it can also build community and social connections. Okay. And here we go. Here's a picture. You might recognize some people who are here today. This is the training faculty. The one thing that I really like about our training faculty is we all come from very different backgrounds. and we bring that to the table. When we develop a training, we work specifically with the population we're serving. So for example, with El Nido, we were really focused on teen pregnancy. We have Dr. Deb Hayes with us, who specializes in military families, so she's been really helpful with that, and other high-risk communities. So let me quickly just say, what do we cover? I think I already told you some of these. A lot of the stuff that you can just read up there, but we want to talk, and one of the things that we found, and I also want to kind of refer back to something you said earlier, which is a training in and of itself is just not enough. So what we've done is looked at how can that training generate something moving forward. And so to that end, we have worked on technical assistance, and the technical assistance is kind of ongoing support, which is partly the pilot program that we have done with USC Eisner and other medical clinics. We are looking at embedded care, but we also have started a consultation group that meets monthly. Anyone who's gone through our training is welcome to come to the consultation group where we can have ongoing learning and support. And we are looking down the line to hopefully have a consultation phone line that'll get there. Want to say another one of our partners, you said 211 was one of yours, 211 is one of ours. We have done a lot. I'm going to let you talk about that more. We've developed a toolkit, which many of you contributed to. Did I not go to the toolkit? I did? Okay. Phew. The toolkit is relatively comprehensive, but as any of you who've ever written anything knows, once you print it, it's obsolete. So we're doing our best to try and stay on top of new information and generate a new toolkit as it comes along. Okay, and this is just a list of whom we've trained. This isn't even comprehensive, and I'm sure we've listed, a lot of them are partners, but a lot of them are people we've just done trainings with. And then the last slide is how are we doing? No, we do pre and post screens. We are doing follow-up screenings. We're asking people who've been to the consultation group what they think. We are talking about this is another thing we've learned. It's just not enough to have you say, a bunch of people in my office really want to learn this. We have to get buy-in from above. Institutional buy-in is a lot of effort, and that's why I have Karen to do that. And we are continuing to look at what are the barriers to getting treatment, what are the barriers to providing the services, and try and support both line staff and to support the general groups, those in charge, those decision makers in making those choices. So with that, I'm going to pass the torch.
Okay, I'm very quickly going to focus on the policy work we've been doing, which is a lot, but I am going to especially focus on a couple projects. But this just gives you an idea of what we're trying to do. And as Karen said, really the ultimate goal. Sorry. Sorry, my slide is not up there. But really the ultimate goal is improving the system of care. And so much of this issue operates in silos between mental health and physical health, pediatrics, OBs, public health, private practice. Bringing those together is a true challenge. Okay. So in our work, we've drafted lots of policy briefs, white papers. Most recently, we drafted a concept paper that proposes 7 recommendations for really improving the system of care here in LA. And we are also about to publish a collaborative care white paper reviewing our project at USC Eisner, which was an integrated care pilot. I'm not going to go through these in depth, but these are the recommendations from our concept paper. A little of them have been talked about already. Consultation line, the trainings, the resource directory, which I'm going to demo in a minute. Home visitation, integrated care, really institutionalizing screening and referral, and public awareness. So I'm going to talk a little bit about our maternal mental health resource directory, which excitingly is going to go live, hopefully next week or the week after. So if you could link to it, I can show you what it's all about. It's been a labor of love. So this will be on our website, and it also can be embedded on any other website, or the data can be fed into any existing program. So it can be used in a lot of different ways. So we have it'll show 150 resources, but we actually have, when it goes live, it'll be about 170 resources, and about 100 of those offer no cost, low cost, or Medi-Cal options. So we're just gonna do a little test here. So can you enter 90230?
Why'd you pick that zip code?
Is that your zip code? Is it?
No.
I don't know, I was just like playing around with it today, and I thought that was like very illustrative of, LA. So if you see all of those resources come up, and can you go up a smidgety more? And I thought I would Westside Infant Family Network, they're one of our lovely partners, so I thought we'd just give them a shout out. If you click on profile, do you see where it says profile right next to their name? What comes up is the services available, the evidence-based practices, so that's really for providers that are looking for something very specific for their patient. Insurance, low, no-cost options. As you can see, they're a no-cost provider. Any requirements, and you can click right onto their website. So it's really exciting. It's, a directory seems a little bit dry, but it's not. And it really serves, I see it as 3 different functions. One is obviously providing tons of resources to the community. The second is stigma reduction. If a woman who's struggling goes on this website and sees that there's 170 providers in LA that do this work, I hope she knows that she's not alone and that this is a real thing and that a lot of people care about this issue. And then the third is what we hear a lot from medical providers is, well, we can't screen for maternal depression because there's nowhere to send them. That's not true. And a lot of that, the reason that's not true is because of all the trainings that Gabrielle's done in PSI in 2020. And so we hope that, I know Yolo County is working on a resource directory and hope to really expand these all over. Okay, I just have one more thing. We can skip that one because Joy talked about that. Just some ongoing and upcoming work. One of the initiatives we're really rolling out a lot right now, we have a grant from Cal Mesa to do a Share Your Story Speakers Bureau. And we use a curriculum, and we're tailoring the curriculum to maternal depression. And it's a very sensitive curriculum that empowers women most women who have been through this are really scared to come out, even though their stories will really empower other women. So the curriculum goes through exercises about, do I even want to tell my story? If so, who do I want to tell? Am I going to be the poster child for this, or am I comfortable telling it in very small settings? And then at the end, the women, if they choose, tell their story. And we just had one on Sunday, and Pilar was there and told her story, and all of the women present did. And after going through the program, a lot of them said things like, well, I wasn't going to share this part, but, and it was a really beautiful, supportive environment. And then last but not least, we are having a policy roundtable on May 29th, where we're bringing together policymakers, local policymakers, state policymakers, providers, a lot of people that can make change in this area. Sorry.
No, I think we're being told that's about it. Did you want to say one more thing?
Thank you.
Okay, we're going to close. Thank you. We're going to close out with a PSA that you all might enjoy for a moment.
Sometimes a ship isn't ready for sea. Sometimes I feel you're not quite open to me. The sun is shining, but you're feeling gray. It's okay, it's okay, it's okay. I'm not saying give me a smile from a frown. Just speak up when you're down. Speak up when you're down. Speak up when you're down.